والصلاة والسلام على رسول الله وبعد. أصلي وأسلم على خير خلق الله محمد ابن عبد الله صلوات الله وسلامه عليه. وبعد, all praise and salutations are due to Allah alone, and may Allah subhanahu wa ta'ala send his blessings and mercies on Prophet Muhammad sallallahu alayhi wa sallam, the last prophet. Indeed, we give thanks to Allah subhanahu wa ta'ala for making it possible for us to converge in this important session. This is a tradition of the African Muslim student at University Putra, Malaysia, that every month they organize such kind of educative and informative discussion, whereby experts from different fields are being invited to deliver a talk like this. So today in our midst, we have one of the most distinguished personnel, as well as a public health expert, in person of Malam Auwal Hafeez, Malam Auwal Hafeez Ahmad. Inshallah, he's going to deliver on one of the salient topics, which nowadays we're in dire need of that because of the health challenges and the emergence and re-emergence of infectious diseases. So because of this session is very, very paramount and is topical and most appropriate for a gathering like this. So inshallah, without taking much of your time, I will briefly introduce Dr. Auwal so that he will proceed with the session appropriately. So, Dr. Auwal Hafeez Ahmad is a graduate teaching assistant and a PhD student at State University of New York, and his major area of specialization is epidemiology and public health. He is a member of New York Medical Reserve Corps that has been helping with COVID-19 pandemic response in New York City since the beginning of the public health crisis. That's during the COVID-19 pandemic. And he has an MSc degree in Geographic Information Science and MPH in Community Health, as well as a BSc in Environmental Science. That is his major, and his minor is Public Health. He has a research interest in the following: health informatics, environmental science, public health, health quality research and evaluation. And during COVID-19 pandemic, he and his brother were able to develop an application which helped in detecting the different locations of COVID-19 testing and vaccination centers in Nigeria. So with this, I warmly welcome Dr. Auwal to proceed with the session. Doctor, you are highly welcome. You can proceed with the deliberation. Thank you.
Thank you so much. Good day to you all. I know it's different time. Some of us, like those here in the US, is morning, and in Nigeria also is morning, but a little bit ahead of us, 5 hours ahead or something like that. And while in Malaysia, it may be afternoon or evening. So thank you so much, the University Putra Malaysia African Muslim Student Body, for inviting me to do this presentation. And thank you so much all for joining. And Dr. Abdullah, thank you so much for the introduction. So without taking much of your time, I will jump into my presentation. So is everyone able to see my slide?
Yes.
Yes, you can go ahead.
Okay, thank you. So the topic is epidemiology, the science of disease in public health. Spoiler alert, epidemiologists are not skin doctors, because we get asked that a lot. So epidemiologists are public health professionals, not clinical health professionals. So the topic, epidemiology, the science of disease in public health, as Dr. Abdullah have introduced me, I'm currently a graduate teaching assistant with the University of New York, Albany. So this topic, epidemiology, or the field of public health, is something that I have experience in since during my undergraduate degree period, where I was able to get a minor in public health at that time. So what I am hoping that everyone that has joined in will be able to get out of this presentation today is you will hopefully will learn more about epidemiology, you will learn more about public health, you will learn more about diseases, because we do with different diseases, the infectious, the chronic, and all of that. And also hopefully this will also be a refresher to you on science, because our topic, epidemiology, the science of disease. So more of the scientific methods and all the knowledge, regarding science can be applied to our field of study. So hopefully that will be a refresher to people that are versed in science, or that are scientists. So what is epidemiology? I know this slide is text heavy. I promise you this will be the only slide with so much text like this. And since it's the introductory slide, so and in epidemiology, we have all these basic stuffs, all these terms, instead of like saying instead of saying death, we said mortality, fatality, instead of saying causes of diseases, we say etiology, uh, disease progression, this and that. So there are a lot of terms that we in epidemiology deal with. So that's why it's good to get this out of the way. So that's why I have to put everything in this slide. But my hope is that at the end of this slide, you will get the hang of what epidemiology is, or what I really want you to understand about the topic. So this is a definition. So people can define things in different ways, and sometimes there may not be right or wrong definitions. So but this definition is coming from the dictionary of epidemiology. So it's defined as the study of the distribution. I know you may not, the word distribution, but in the epidemiological concept, it may be a little bit different than the way you know it. So the study of disease of the distribution and determinants of health-related states and events in specific populations, and the application of this study to control health problems. I know there is a lot to unpack in this, so that's why I have the key terms where I would take one. I would take the terms one after the other, and then try to clarify. So as the definition, epidemiology is the study. So it's a study, but not just a regular study. It's a scientific, systematic, and data-driven. So that's what make here you will understand why epidemiology is considered as a science, because it's a scientific. So all the scientific methods can be applied to epidemiological study, and it's systematic. You start from the theory, or you you start from the observation and hypothesis testing, the hypothesis, the experimentation, and it's data driven. So for example, it can be said that lung cancer, smoking causes lung cancer. So in epidemiology, when you say something like that, you have to have evidence, you have to have multiple reasons, you have to studies have been conducted that will prove to everyone within any reasonable doubt that yes, smoking causes lung cancer. So it is data driven. So when maybe you see someone smoking and then the person developed lung cancer, then that's not enough. Maybe someone will argue that I have known someone that the person is now diagnosed with lung cancer, but the person have never smoked in their life. So how do you reconcile that? So that's why the data matters. That's why in your study, the sample size, and that sample size has to be representative. Who are you studying? Are you studying people that are about to get the lung cancer? So, or you studying the general population and you want to test to see if the exposure to smoking or exposure to a contaminant will make them develop that outcome, that health outcome. So it has to be data driven. You have to have data to support that, to let you have a statistically significant result, and it has to be in a systematic way. Your study design, there's the statistical analysis. You have to use all the appropriate methods and measures to show that with this exposure we can have these health outcomes. So I hope you understand why epidemiology is considered as a study or as a science. So it's the study of the distribution. So it's not just a science. It's what we focus more on is the distribution. So what is distribution? So we look at the frequency and pattern. So for every disease, so just the distribution, as I said, is frequency and pattern. So some diseases you see the rate of the cases in regarding that particular illness or health condition is higher in this population or is lower in that population. So epidemiologists, we pay attention to that, and we not just pay attention to that, we ask ourselves why there are more cases of this disease today than before, why there are more cases of these particular diseases in this particular population at this particular time. Why? So that's why in epidemiology, place, person, and time is important. We analyze things based on that. The place, because some places will have less, the prevalence of diseases or health outcomes in one place will be lower than in the other place. So that's why in epidemiology we use those words a lot, like outbreak, epidemics, endemic, pandemic. Yes, so because it's based on the distribution of those diseases. So how do you define, and the reason why we use those terms is to call the attention of, because studying about something or learning about something is nothing without taking action about it, especially when it has to do with health. The people's health have to be protected. So regarding the disease frequency, when should a disease be, when should cases be considered as an outbreak? So in epidemiology, the first case in any disease, so the first case of COVID-19 is considered as an index case, because normally when you have, especially it's something that have never seen before, so the first case will definitely get the attention of authorities, not just the healthcare professionals, but the authorities. The politicians have to be involved, the general public has to be involved. So but when do you decide you should start using those terms? So for example, one case of polio, just one case of polio will be considered as an outbreak. So outbreak is normally more than one cases, but that's for the diseases that are common. So when we are in the malaria season, when we have one, we may not consider that as an outbreak. And also it's depend on where that thing is. So if malaria is new, maybe in the Caribbean, maybe in the ocean, in Oceania, or in any other place in the world where where they have never experienced malaria case before. So when one case can raise an alarm. So an outbreak for polio, just one case is an outbreak. For some diseases, it can be 2, it can be 10. So the epidemiologists, they monitor this, and we look at, we know all these terminologies, we know all these principles, that when you have more than this amount of cases, then this should be declared as an outbreak, and then this should be declared as a pandemic. I mean, when will it even reach a level to be considered as a pandemic? So all of that's very important in epidemiology, the distribution of diseases or health outcomes or health related state or events. So also the pattern. So as I said, from the frequency, we will tell more on this is COVID-19 still a pandemic? It depends on the frequency, the frequency. So but for the pattern is that some diseases you see there's a particular pattern. It's some diseases may not affect everyone. Maybe there are particular people that they get affected by those diseases, or maybe it's depend on the location, that if you go to malaria is a big killer disease in Africa, or in Nigeria in particular, but it's not that in the US. So we look at the pathogen that is causing the malaria. We look at the vector distribution is higher in Africa. So the female Anopheles mosquito, it will thrive more in Africa than in the US. So it's not there. It's not in the US. So of course you won't see the disease pattern of malaria in the US will be different than it is in Nigeria, because in the US it's mostly the imported cases. So someone would get the malaria in Africa or any part of the world, and when they come to US, then they may be diagnosed with that disease. So we look at the pattern. So there will be time when you will see cases of diseases dropping. So we look at why the cases are dropping, why now we are having less cases than before. So we investigate. So that's why we also call disease detectives. The epidemiologists are called disease detectives, because distribution and patterns are so important to us. So epidemiology is the study of the distribution. Now you understand what when epidemiologists say distribution, what they mean, and the determinant. So this is also important. So determinant, I mean, in English language, when someone is determined, or the word determination means like you committing to something. But in epidemiology, it may mean kind of the same, but it's not really committing. It's more like the causes, the risk factors making people get exposed or developing some diseases, or having health-related states or events occurring. So the determinant. So determinant, as I said, the causes. So we look at why people are having these diseases, who is at risk of having this disease. So sometimes it's depend on the person. So for example, breast cancer, you expect a woman to be having that, right, because of the anatomy. So so that's determinant of that's determinant of breast cancer. Also the lung cancer, smokers are at higher risk, based on research have shown that smokers they are at higher risk. But you see that the case of women with breast cancer, that's more anatomy, that's more has to do with biology. So we look at the biological determinant. That's the so for example, also with this disease, sickle cell anemia, determinant you can someone's genotype. So you have to put genetics into place when you considering what to do to help regarding sickle cell anemia. So you have to put it, and it's good that many people are going for screening, genetic screening before they get married, because they see that if someone has AS, when they marry someone with AS, the chance of them having children with sickle cell anemia is higher than, or is dear than someone that is AA marrying AA. So that's the determinant. And as I said, we look at that from the biological point of view, from the physical point of view, and we look at the environmental. That's why we have a whole study dedicated to that called epigenetics. Look at the genetics and how environment, because sometimes you will have twins and genetically they're kind of the same, especially identical twins, but then they may have different health outcomes in their life. But why? Because it's they may not be living in the same environment. The exposure to things that will make them develop diseases is higher, and all other factors too. So you have so the determinant, and sometimes not only the physical or the biological or the genetical, or the environmental. You also look at the social. This is kind of new in some ways, because so I have my master's in community health. So in community health, social determinant of health is important. So they're saying it's not only the gene expression of someone or the genetic makeup of someone that will make them to be more vulnerable or more at risk to some diseases. So then they're saying it's not only the genetic makeup or the environment. No, but yes, the environment, not just the physical, not the pollution, the contaminants that are present in the environment, exposure to them that will put one at risk to develop diseases or make it worse. Because sometimes the determinants, they're not just the thing that will make you develop the disease, but maybe those contaminants are there. They won't be the triggers for you to get the disease, but once you get the disease, they will make you have worse outcome than someone that is not exposed to that. So we still consider them as the determinant. So they're saying it's not just the environment, the pollution in the environment, but socially what you're going through. So sometimes people may get discriminated against because of their race. So racism is considered as a social determinant of health. So in countries, unfortunately, like US, where racism, it's not as bad as it used to be. There will be always racism. People will always exploit differences and stuff. Or in Africa, issue of tribalism. Maybe someone's tribe, people may get discriminated against because of their tribe. So the stress, that the stress, that's mental health itself. So sometimes it won't be what will make you have that disease, but then when you have that, managing the disease will make it worse because of your race or your or your tribal or any other factor. So that too can be a contributing factor in making people to be having poor state of health or to be having the worst health outcomes. So we look at the risk factors. As I said, we look at the causes. Yes, if there are people that are immunocompromised, like children, their immunity is not that strong like the adults, and the pregnant women, the elderly, they're more at risk of developing some diseases. On even if they don't, even if their state will not make them give them higher chance of developing those diseases, but at least when they have it, the chance of them surviving, that is higher. So this is what we mean by determinant of health. So we look at everything. We look at what will cause, what will make one vulnerable to health related issues. So So we're still on the definition. I know, as I said, this is kind of lengthy, but we just have, I want us to have this out of the way, because this slide is more on the bulk of our presentation. So epidemiology is the study of the distribution and determinant of health-related states. So health-related state, of course, you know, we have different kind of diseases, you know, the infectious, you know, mental health too can fall into that, and events. So when we say events, so before it's the concern was mostly on health-related issues, as I said, but now we also add in the scientific community, the public health professionals, or or people studying medicine and any health-related study. They realize that it's not just the diseases that we should be focusing on, or it's also the events. So epidemiology, epidemiological methods can be applied to events. So events can mean natural disaster. So it's not only when someone is sick or things like that that epidemiologists will have a role to play in terms of studying that that phenomenon or studying that event, but then not just the health, but also maybe issue of security, issue of insecurity. They are all health related. They are all what's the term of epidemiologists. So example for the case of security. So every security issue is a health issue. So when, let's say, one community, they in fear of an attack, so there is an imminent attack coming to that community. So when the attack comes, people may get injured, people may get hospitalized. So it's so obvious to everyone that's health-related issue. Yes, because people have sustained injuries, and that's why it's bad that they can even be taken to hospitals, and then maybe it may end up claiming their lives. So when that happened, you know, it's so obvious to everyone. But how about if the attack has come, but it was on their properties? So people lose properties. So now I make the claim. I said, the public health professional said, every security issue is a health issue. So how about if it's not the people that are the victims, it's their properties, but then still they are the victims, because when people lose their properties, that's mental health. The stress and all of that, they will be depressed. That's mental health. And if you look at it, it will, as we discussed about social determinant of health, so the environment, or what's happening in your life that will make your health condition worse. So of course, when they are depressed, losing properties will put them at risk to exacerbating their they may be diabetic, but then that will maybe deny because they lose money, so they won't get they won't be affording their medications as they used to be. So you can look at it from different angles. Yes. So the event, so that's why we not focus only on the things that we think they directly lead to health, even those that have indirect relationship with health. So I think from this, like, you really get what epidemiology is all about. That's studying of those health-related state and events in specific population. So you remember, epidemiology is not medicine, it's population medicine. So public health is population medicine because you're dealing with the public, not individual. So that's why epidemiology, we don't care about studying one person, we study persons. So we study people, and then we study specific populations. So that specific populations can be people in the neighborhood. Or maybe you see that the asthma rate in one neighborhood is high. So the doctors will be doing their work of examining one patient at a time. So that's what differentiates us from medical doctors. So they will be examining one person at a time. That then the data that they have, or will help them collect the data on how many people have they examined. So they examine 10 people. A physician may examine 10 people in a day, but the focus is just one person. So if that person, if a physician, when a physician is talking to one person, the focus of the physicians are trained to focus on only that person. So when that person is telling them, I have this and that, it's none of the physician business to decide, oh, since he or she recommend this treatment or medication to the person before this one, then that person should get the same thing. No, it's just on you dealing with the person that you're dealing with. But for us epidemiologists, what we do is that we look at what the first patient, the second patient, the third patient, and all of that have in common. So that's really what differentiates us from medicine. So physicians focus on one person at a time. We focus on many people at a time, and those people we select. Is it our research area or our research of interest can be on where you can study the whole world and say, I want to look at cancer in the whole world. You can't be everywhere all the time. So you have to collect the data. So you may decide to just focus on your neighborhood. Maybe you see more people are getting one illness in your neighborhood than before. So it can be school, it can be city, it can be even global. Yes, it can work globally. You know, that's why during COVID you have all these dashboards, you know, all this yes, John Hopkins University collecting data, or WHO collecting data regarding the public health threat that is present globally. So epidemiology can be applied so that you can study the data that is collected. Yes.
Hello, sorry for the interruption. Can you share the slide again? Somebody has interrupted that.
No problem. Thank you. Yes, so are you able to see it now? Can you see the slide?
Yes. Thank
okay,
you.
yes. So yes. So as I said, we look at the neighborhood, we look at different geographical locations. So it's not just individual. So the focus on population instead of individuals makes epidemiology a public health study. So this is more about, as I said, this slide is more text heavy than any other slide, and it has more information probably than any other slide. So once you have this, once you good at this point, then the rest of the presentation will make more sense to you. You enjoy it more, hopefully. So the differences between public health and clinical health. So what differentiates us from medical doctors? So as I said, public health. So epidemiologists, they are public health professionals. So public health is, from the word public, you're dealing with the public, not just individuals. So our study, so we apply epidemiological methods on the population, not just an individual. So we examine the population. We don't examine one individual at a time like medical doctors do. So examples of healthcare providers are physicians, you have nurses, you have dentists, and all of that. But for public health professionals, we have environmental health workers, we have health educators, we have community health workers, epidemiologists, you name them. So hopefully, since I've already discussed in the previous slide the differences, so hopefully this will even make it better. Even if you have question, maybe still trying to haven't get the hang of the differences between epidemiologists and medical doctors. At the end of this presentation, you will have time to ask, and I will go over it more with you, or bring more explanation that will make more sense to you. So now we know that epidemiology, it falls under public health, not a clinical health. So more about the public health, as I said, this presentation will let you know more about public health in a nutshell. So there are 5 core causes of public health. So yes, we have behavioral science. So we have people, their focus in public health is behavioral science. So in behavioral science, they're studying how do humans behave. So you have you can study public health with concentration in health promotion. So in that case, you'll be taking more psychology courses and all of that. So I was doing a Doctor of Public Health program. So I have two masters I have masters in community health, but then I decided to do my doctorate in health promotion. So I was more on the behavioral science on that before switching to epidemiology. So my doctorate was before more on behavioral science. Now I switched to epidemiology because epidemiology is not just the science of public health, is the foundation of public health. Everything starts from the epidemiology. We get the data, and then from there everyone can take it and then do and help with the researchers, with the scientists of public health. So other health professionals, other public health professionals have to wait for us or usually rely on us to get the data for them and the research, and then from there they will apply their own discipline to make sure that they also give contribution in making people safer, helping people with what's good for them regarding their health care. So we have the behavioral science where the focus is on behaviors, and also the animals, because we shouldn't left the animals behind too. We should know about their health. That's why you have veterinary medicine and with the other medicine. So also in public health, you can focus more on the animals if you want. So you have the health services administrations, which is more on what goes on in the health settings. So you're focusing more on what's happening, how to help hospitals run. So it's not only doctors, that are or clinicians that are needed in hospitals. You need people that will register those patients. You need people that will do research in the hospitals. So you need people that will look at the payment methods, health issue of health insurance, who have health insurance in the community or not, and stuff. So that's health services administrations. I almost have a minor in that too, but I almost have a minor. In fact, it was I thought I even had a minor in that at the beginning. So it's something also very interesting in health services administrations. So the environmental health focus more on the environment. So you're dealing with the pollution, exposure to chemicals, exposure to pollutants, the effects on that on people's health. That's more on the environment. So if you really want to do something about the environment, when it has to do with healthcare, you remove what's causing so example, curing malaria, you take care of the environment that will not leave the breeding ground for mosquitoes to reproduce at the first place. So if you take care of the environment, then you helping people stay healthier. Or case of Lassa fever, you get that from these rats. So if you make your house less attractive, or the environment or the neighborhood less attractive to rats, then that will help in fighting against Lassa fever. So the environmental health will tell us more about that. And alhamdulillah, my bachelor's degree is also in environmental health. So and then epidemiology. So epidemiology is I have discussed everything about that. You see who, when, and where, the patterns, the determinants, and also the biostatistics. So epidemiology and biostatistics, they're kind of the same, because as I said, epidemiologists, we are the researchers, we hold the data, but then biostatistics will help you. Statistics will help you use what statistical analysis to do regarding your study. So in some schools, you can't even study epidemiology without studying biostatistics. It's the same thing, epidemiology and biostatistics. That's what you get your degree or your master's on. But in some schools, it's just one or the other. But in whatever may be the case. So now I'm studying my PhD in epidemiology, but I'm taking a lot of courses in biostatistics, because I can't do without biostatistics. I need the statistics. I need to have the skills to do the statistical analysis, the regression modeling, all of this and that. PhD tests, just different kind of studies, chi-square tests, just on categorical data, what tests you do on categorical or non-categorical. So you have to, the knowledge of statistics is key to us. So these are the core courses or disciplines in public health, and most of them is either I study them without finishing them, or that's what I have degrees on them. So which is, in public health, it's not, that's why that is important to have your hands in so many things regarding what you're doing. So brief history of public health. So even though I have explained to you what public health is, but then the brief history of public health. So how did the world decided that we should focus more on public health? We should have all these disciplines. Someone has to start somewhere. So where did the world start? So first of all, anything regarding public health, the courses, it won't really get the people's attention. So example, you're having one case, and then tomorrow you're having 2-3 cases of diseases. So that will get the attention of people, that why are we having all of a sudden these illnesses in our society? Why? So normally people will always ask why. So normally, like COVID-19, when it started, people are asking why. So all this why. So people will have different opinions or different ways of seeing diseases. So the causes, what caused the diseases? People say, oh, it's because of this and that and that. So in Europe, at one point it was the miasma. So people think people get sick because the ear is bad. So when the ear is bad, it will make everyone sick. It kind of makes sense. So that was the belief. At that time, people don't know that we have microorganisms. So there wasn't microscope. So people will be thinking it's this and that. People will be thinking, religion, witchcraft, this and that. But at one point, Europe was thinking about the miasma. So, but then later on, with more research, so the development of germ theory came into place. So, so the transition from, at least from this point, from miasma to now that we know that there are microorganisms. So now the focus is more on, yes, the germs, the what we don't see cause those diseases. But at the same time, as I said, like personally in my own case, I believe, yes, it's the religion too can play part in that, like the exposure, everything is predetermined. But at the same time, so someone will get sick because there are this bacteria presence in the environment and the person have this exposure to those diseases. But at the same time, I believe that God put those bacteria at the first place, and it's just predetermined that you will have the contact in them. So I believe in religion and science overlapping. Sometimes not really always they are at conflict. So the germ theory tells people more about that it is the germ, that it's the microorganism that will make you sick, which is the acceptable theories out of many theories in the scientific communities. So once you know about the causes, that people are getting sick because we have viruses, we have bacteria and other pathogens that are too small for us to see them, but they are responsible for changing our state of health. So knowing about that, then people start to think, but then, so if this person is sick, when will the next person get sick? So that's a transmission. How do the disease leave one person to go to the other? Then you have the infectious diseases. So exposure to that, and then scientists will come up with ways based on the data. As I said, epidemiology is data driven. Based on the data, you can tell exposure to, so like COVID-19, exposure to how long will you stay when someone is infected with the COVID? How long will you be in close proximity to them, and how many feet the distance? So that's the transmission. So if you are 6 feet or 3 meters, right, or 2 meters. So if you are in that proximity to that, and then maybe for 15 minutes, so some diseases like tuberculosis, it has to take longer period of time than some diseases. Maybe one disease, the exposure maybe in 1 minute, you may get the disease. Maybe for some disease, it will take longer. So you have different level of exposure for the disease for you to have the disease. And also some diseases just one. So the infectious dose. So sometimes it's not just the exposure. Okay, you are in close proximity. You are in proximity to this person that have this disease, and the person is exposing you to the virus or to the pathogen that make them sick. So how long will you stay close to them for you to get the disease? Sometimes it's also depend on the number of virus. So for some illness, just one virus is enough. But for some illness, if you can take one virus and put that in someone's body system, that person will not get that disease because that's what they call infectious dose. So it has to be some diseases will have 10 viruses to be able to cause you that disease, or 100, or some diseases can even be more than that. So we pay attention to the transmission mode, and then more about that too. Also the prevention. So now you know that, okay, this is what causing the disease, and then the exposure to that, people should stay away from that because this is infectious. But and then some diseases, the transmission, it has to be biological. So it has to be, genetic. Like, so the case of sickle cell anemia, when we get that from our parents. So our parents our parents genotype will play part in us having that disease. So those diseases are non-infectious. So the kind of preventive methods depends on the transmission and the causes. So for infectious, then you have the authorities saying we should wear mask because that will reduce the infections. But then imagine if you said, okay, so if you don't want to get sickle cell anemia, then maybe wear a mask. You see, that will not make sense because that's not you don't usually get that. You don't get that through you can't protect yourself just wearing mask. So in the history, since this is the brief history of public health, people are paying more attention to what should be done for the prevention. And I read this article where they mention about ablution in Islam, that the 5 daily prayers will wash our bodies. So that's very important. The cleanliness, that's also ways to support public health. So the 5 daily prayers are not just the spiritual. You can see them not just from the spiritual point of view, but also from public health point of view. The ablution, you cleaning yourself. So those microorganisms, you're removing them from your body without even knowing. So the washing 5 times, of course, will make you, if you have them, it will be less. That's why in hospitals, the doctors, they wash their hands all the time because they know we carry those illnesses. So the prevention, there are different ways of the prevention, the wearing mask, going for genetic testing and knows what one's potential genetic makeup is. Maybe that will make you not compatible, things like that. So the prevention and the world has come a long way in that too, in public health, because what should be done to to protect people, it's not as clear as it was before. So, and regarding this issue of hand washing, in one of my slides, there is the case of Similways, where he got in trouble trying to tell people that you should wash your hands to protect yourself from diseases, because at that time they didn't have the microscope is not there, so people if they can't see virus, they won't believe virus exists. But then somehow this guy was a genius. He understand that there must be something. We don't see everything, but there must be some things causing diseases, that by washing our hands, we will protect ourselves more. So in the public health, the causes, in the causes, the world has come a long way in that, the transmission, the prevention, and the data collection. So you see this John Grunt, the bills of mortality. In London, this was 1662. This is like 400 years ago. But even at that time, London decided to start recording the dead and bad. So this is called vital statistics. But this is sometimes when I look at things like this, you see this was 1662, right? But then up to today, in Africa, it's only Egypt and South Africa have complete dead and bad registration system. So look how far. So London, they were recording that long ago. Because why this is important, let me explain. So in the US, every year, if I remember the statistics correctly, I think 2.7 million people died every year. 2.7 million people died every year. So normally 2.7, 2.6, 2.8, within that range. But in 2020, 3.3 million people died. So without even test for COVID, when you see, so when they see that beyond the average, they call that excess dead. So from subtracting the excess dead, you can tell that there is something wrong in the population. So even if US, they don't have diagnostic good, they're not conducting tests for COVID, but then imagine in 2018 they had 2.7 dead or 2.6 dead, and then 2019 2.8, and then all of a sudden 2020 they see 3.3. Then that will give the authorities chance to start investigating. But then in Africa, we still stuck. We haven't developed a comprehensive vital statistics recording system. We haven't. It's only Egypt and South Africa. In countries, in countries, you have people getting the record and stuff, but then it's not comprehensive. So that's why this is important. The data collection and epidemiology will have more in that. So this is the John Snow, as I was talking about. No, I haven't talking about just John Snow, but this person is considered as the father of epidemiology, because in one outbreak in London, he was investigating the cause. So because at that time, two people don't have the microscope is not there. People don't believe that if you don't see germs, they exist. So the people were getting their water supply from public pumps. So they go, even in London at that point, you get the water supply from the public source. So the water was contaminated, the handle was contaminated, and people keep getting the cholera. So Johnson was able to investigate, and then he recommended the authorities to remove that pump, and then the cases dropped, and that brought an end to the epidemic. So that's why this person is considered as father of epidemiology. And you see, he collected data and he created a map. Actually, he created a map, and then you see where the yellow is. This is the Broad Street pump. You see, this is called a heat map. But before, he just did a dot density map where you will have things that you are suspecting and see if there is cluster around what you're suspecting. So it means that area in particular has the problem. So he was able to be convinced that definitely something is wrong with that source of water. Even though you can't see the bacteria for the cholera, you can't see that, but he somehow understand that that's the cause. And then he was given the credit of being father of epidemiology. And in fact, he was the reason behind studying about him really pushed me into the public health more, because I was doing masters in GIS, and then I realized his work, and then I said, oh, I can use my mapping skills to help in epidemiology, to help in public health. So you have another person that I have discussed about him briefly, similar ways. He was able to prove to people that hand washing is important because he saw two clinics. The first clinic, doctors and medical students are the ones receiving uh, the bad delivery, dealing with the bad delivery. The second one is the midwives. But then, ironically, the first clinics where doctors are, people are dying more than the other clinic. So he was convinced that something is wrong. So what was happening was that the first clinic, doctors, they will do surgery and they won't wash their hands properly. And then when they come to trying to help women deliver, so they will introduce those pathogens to the women, and then they will be dying from child bed fever. That's what they call it. So he was convinced, even without knowing that there are microorganisms, that something is wrong. So he recommended hand washing, and the cases drop. So that's why he was considered as the father of infections control. So this is my last slide. The public health surveillance. So it's all about data collections. You continuously the continuous collection of data in a systematic way and analyzing that to help protect health. And you have different surveillance system. You have syndromic surveillance system, where you look at the syndromes without waiting for disease to start developing. So this is the public health surveillance system, and this is the end of my presentation. Thank you. Any questions?
Thank you so very much, Dr. Auwal, for the wonderful presentation. Indeed, you have highlighted key important issues, particularly related to public health, and especially the etiology of disease and how epidemiological methods have been applied in order to control the spread of infection. So now we are at the question and answer sessions. So if you have any question, you can kindly either write in the chat box or indicate by raising up your hand so that we can allow you to put forward your question. Thank you. But it's like at the chat box, I saw Yakubu Yahya asked one question. He said, what do you have to say about the controversial conclusions that COVID-19 is rather genetically and not linked from laboratory proceedings? So I don't know whether Dr. Auwal has gotten the questions or I should take it again.
Is it the chat? Yeah, I think I have. I think I have gotten the question. So as the person asking the question have rightly mentioned, this is controversial. So it's more on politics. Like, so we believe in, I mean, the popular belief among the scientific community is zoonotic origin of COVID-19. So we got that from animal. That's the popular belief, and that's the one I'm more convincing. Saying that it was engineered in lab, and that this hasn't gotten acceptance in the scientific community. It may be possible people can do everything, but the zoonotic origin, that's saying it's from animal, it's from pangolin or from bird, that's more, it makes more sense to me than the other theories. Hope I answered the question.
Thank you. Yeah. So let me allow Gladys Abel. I hope I have pronounced the name correctly. So if you are available, you can unmute yourself and put forward your question. Gladys Abel.
Yes. Okay, thank you very much. Dr. Auwal, thank you so much for this wonderful presentation. It's so timely. We are so grateful for opening our eyes. Yeah, my question is, how can epidemiologists assist in getting data in a systematic way like Nigeria? Because I discovered that getting data is it's very difficult, because there's a research that was retrospective data was really a challenge. So I'm an MSc student, so your word of experience, how can an epidemiologist assist in getting data?
Yes, this is a very good question. Yes, I'm glad you asked about it, because my last slide was reported wholly on public health surveillance. So that's key, getting the data, but then who is going to provide the data? Who are going to collect the data? So as I highlighted, that having data on dead and bad can tell you if something is going wrong. If normally in every month 10 people, normally 100 people die in one neighborhood or in community normally, or in a state 1,000. Then next month you see 2,000, or the month after you see 3,000. Then you have to start investigating. So epidemiology cannot work. Epidemiologists cannot really do their work without. But then that is what they call the multi-sectoral approach. So it's not, if the government cannot do it, individuals have to do it, the researchers. So people should do more research. And I think also it's like, obviously you have interest in research, so do more research, and that can help the government do more research. And also the government too should help more, employ more epidemiologists, so that they will help in the data collection. I can go I can go on and on this, and I can even talk to you about the current state of the public health surveillance system in Nigeria, and I can compare it to the US. And this is something that I even wrote something about it. I even have proposals about that, and in fact, I'm even in touch with the NCDC, trying to bring interventions that will help solve that problem. So it's something that I'm very interested in. It's something that I have devote my time and my experience and all of that to study it, and not just studying it, but also I'm doing something about this. But as I said, everyone should do something about it.
So thank you, Dr. Auwal, and I think Dr. Auwal is open for collaboration. So those of you in epidemiology and public health can actually contact him for collaboration. Thank you. So the next person is Musa Yusuf.
Sorry, please for interrupting, please. Yes, if you can help us with his contact.
Gladys Abel, we have limited time, so I can share his email address. You can contact him for further discussion. So let me quickly go to Mr. Musa Yusuf. You can unmute yourself and ask your question. Thank you.
Okay. Assalamu alaikum. My name is Musa Yusuf. This is a very good presentation from a good friend of mine, who is Dr. Auwal. Alhamdulillah, he's a very good friend of mine and also a colleague to me. I'm a full-time lecturer in Bauchi State University, Gadao. I'm a public health practitioner. Even now, we are in the same step with Dr. Auwal. I'm doing my PhD now in public health from Nigerian University, that is Novena University, Delta State. Doctor, I think this is a very good recommendation, and I have a very appreciation with that very good presentation that you did. I have one observation or one question that I need you to elaborate it so that I think many people will benefit from it. Especially, you know, the backbone of this public health or epidemiology is the surveillance, more especially the active and the passive surveillance. Please, doctor, I need you to elaborate it or to open it more on this issue of active surveillance and passive surveillance so that many people will benefit from it. Because if I may say something reasonable on it, in Nigeria, we are having issues with that diseases concerning epidemiological diseases, more especially we are failing in time of this surveillance, more especially the active surveillance and the passive surveillance. Please, doctor, say something little about surveillance so that I think many people will benefit on it, more especially the active and the passive surveillance. Thank you so much.
Yes, thank you so much, my colleague, my brother. Thank you so much for your commendation and for the question. Yes, I am just being mindful of the time because as I said, I can go on and on. But then let me speak briefly about the surveillance. As you said, we have the passive and you have the active. So the passive, just from the word passive, so it's the government just letting people bring in the data for them. But then you have the active where the government making sure that they're getting the data. So I think one example that I will give that will make more sense. So it's like if there is an insecurity, issue of insecurity in one community. So the government may decide to have people, informers. The government may decide to have informers in the communities that when they see certain threat coming to the community, they will tell, they will notify the authorities, and then so that can be the active, that the government actively getting the data, or you can have the government or people reporting that themselves. So it's so important. One is not more important than the others, than the other. Normally they have to be done together. So the government should be the ones seeking those information. They should have dashboards. So in US, that's why I don't want to go into more on the surveillance. So you have this like CDC having these different dashboards. There are dashboards that when physicians, let's say, prescribe medications and stuff, when control substance is prescribed, the system will automatically send notification to CDC. So from there, if a doctor is prescribing the dosage that shouldn't supposed to prescribe for that person, or the CDC can even know that some in this particular hospital, one doctor, it's something, the system can flag that. So more like an early warning system. So they have all that set up here where the government is collecting the data without even physicians. The physician may know about it, but then they will just see that they're interacting with the system while the system is sending them the data. So they have different ways of doing that. And I wish I would have, like, because this can be a lecture of its own. I think I can spend like an hour discussing in details more about this and that. But then because of the time constraint, so I hope people understand passive and active and why they are important. It has to be put together. Just like if you want to show the people the security, you have to have informant that they will create early warning system, and then you have to have also the general public participating, that when something go wrong, then they come in. So the same thing with every health issues, you have to have systems, you have to have things in place, creating early warning system to the authorities before things getting out of hand, and you should have those taking more of reactive measures. So at the same time, it has to be all layers of supports, all layers of different practices from different individuals put together, both public and private. Yes, thank you so much for asking this.
Yes, thank you, Dr. Auwal. So let's quickly move to the next person asking the question, Abubakar Dawood. Abubakar Dawood, you can go on and ask your question. Is Abubakar Dawood around? So maybe let's go to the next, Hussein Sadiq.
Good evening, Dr. Auwal. Can you hear me?
Yes.
Okay. Mine is on the issue of surveillance, as rightly pointed by one of the questioner. How reliable or how valid are data obtained from both active and then passive surveillance? And in case of passive surveillance that can be kind of generated by individuals, do they need to undergo a kind of validation, the data, I mean?
So your question is about data quality, right?
Yes.
Regarding whatever means the data for the surveillance to be used for surveillance purposes is collected or is gathered. Yes, this is an issue not just on surveillance or not just on public health. So the thing is that it's complicated because, as I said, as from the example I gave, if you really want to have surveillance done, it has to be active, it has to be passive. So if the government say, oh, people will not be giving us the right information, so we have to have our trained expert, only our trained expert giving us the data. It won't work that way, because a lot of things will be missing, because you have to have the public in that. So it's hard, it's difficult, data quality, but what the government can do regarding that is that to have expert analyzing the data. So the data has to be coming in. Yes, the systems to get the data public, the data public should be encouraged when they see certain health outcomes happening in their places. They should let the authority know to investigate. But at the same time, there are ways that the government can do to make sure the data it's correct. So using social media. So in syndromic surveillance, from my slides, you will see that social media is part of the component of syndromic surveillance. So if I was able to share the slide again, I would have shown you where you have social media, because things will start happening. You may know about something through social media. You know, as less it's even though those companies, the platforms, those giant tech companies, they kind of making sure that things are going okay. They can remove a poster they think they're misleading, or especially when it comes to public things that will create big public reactions. So even though they're doing their best, but at the same time, social media is full of all this and that. But at the same time, you can't take social media out of the picture, because a flooding may happen or insecurity may happen. Even the authorities will get to know about it because someone posted about it. So it's something very complex, very complicated. But then the government should I encourage the governments to be hiring more people to collect the data, at the same time to hire people to not just collect the data but analyze the data, but also accepting data from different sources. They should even be diversify the sources of the data more.
So thank you very much, Dr. Auwal. I think due to the time constraint, Dr. Yakubu Yahya, I saw you raising hand. Unfortunately, the time is not on our side. And I read one of your questions posted on the chat box. So I will quickly go to Abubakar Dawood. Abubakar Dawood, you are the last person to ask the question. So go on, please.
Okay, thank you. Can you hear me now?
Yes.
Can you hear me now? Okay.
Yes,
so
yes.
thank you very much for this wonderful. Okay, thank you. Thank you for this wonderful presentation. My question to Dr. Auwal goes like this. Do you think medical record practitioners has a role to play in public health setting? Because I think most of the challenges we are having in surveillance or public health is things that has to do with data collection. So I think medical record practitioners should be carried along in public health because they are trained to collect and analyze data. So if you look at the collection of the team in surveillance or maybe epidemiology or public health, mostly you see the population is mostly for medical doctors. So I'm maybe suggesting, and I think maybe people like Dr. Auwal and others should advocate more on this, that professionals like medical records should also be carried along, because there's their own solemn duty to collect analyze data that can reduce the data discrepancy we will be having maybe in public health organization or setting. Thank you very much.
Yes, that's a very good suggestions. Yes, the more professionals, you know, if you have more trained individuals handling something, you expect to hopefully see better outcomes. Yes, I agree.
So thank you very much. In this note, we have come to the end of our presentation, and we appreciate all the participants for attending the session, and particularly the presenter. We must say, Jazakallah khair. It is indeed a wonderful presentation that is a thought-provoking one. That's why we have been having much questions. So inshallah, in the maybe next few months, if there are some burning issues, we can still invite you to present more. So Jazakallah khair. May Allah reward you abundantly. Assalamu alaikum.
Thank you so much.
Thank you.